Serena Chen, Dr. Serena Chen from IRMS, New Jersey, and it was your first full day of telehealth consults. I want to check in on that. How'd they go?
You know, they went really, really well, and it might not be a good thing for me because I tend to be a talker, and when I'm in the office, you know, my medical assistants are like, Dr. Chen, it's time to do the exam. Yes, exactly. They're like, okay, Dr. Chen. And on the video conferences, I just been really, it's a little bit more intimate, and I've really been enjoying talking to people about how their life is now and what's going on and with them. And I always like hearing about like the personal side. So it's because I can't do an exam. We can take a little time to just get to know each other a little bit better. So that's really, really nice. And then, you know, one of the things I tell all couples is that while infertility is really stressful and not something we would wish on anybody, the silver lining is there's a huge opportunity here to make a huge difference in your general health and your preconception health so that ultimately you can positively impact your pregnancy outcome, because we all know that being healthier beforehand is actually the way we would ideally like it to be for everybody. And people that get pregnant right away actually don't have that opportunity. And so our infertility patients have an opportunity to talk with a physician and really find out like all the things they can do to be healthier, like eating more vegetables, less sugar, getting better sleep, getting exercise, and avoiding things like Zika virus and coronavirus and the flu, things like that. So you know, you and I are both big health proponents, preconception health proponents. So that's just been such a wonderful thing for me to be able to like even, you know, emphasize that even more, because in a video consult, when you're on kind of when you're sheltering in place or social distancing and you really can't get out, that's what you have left. You have to sit at home and kind of think about like, how am I gonna reduce my stress and get some exercise in and do a better job with sleeping, maybe work on sleep hygiene a little bit. I had a patient today who she's struggling with sleep, and one plan we came up with was, hey, there's a lot of cool apps on your that you can download onto your phone, because the phone has a motion and a sound tracker, and a lot of these sleep apps can use that data to give you feedback about the quality of your sleep. And that might, like for me, I use the sleep tracker, and that's helped me figure out that I need to do my big meal of the day earlier in the day, because meal, it's a huge impact.
It's a really cool point. I'm glad to hear that you're even doing that, identifying neat technology that they already have access to.
Right.
Just be utilizing it in a different way right now. And certainly I think with high anxiety levels all the time, but in particular right now, I feel like a lot of people are having trouble with sleep quality.
Yes, absolutely. And another thing I love to use the phone for is for meditation apps.
Yes,
like right? There's some great stuff like Headspace is great, Calm is great. 10% happier.
They're offering free access right now too.
Exactly, just because of the crisis now. People are really stressed, and they're trying to do their part by giving more people access. So I think that's another thing to work on a stress management plan and meditation. So much data. That's a whole nother topic. So much data on some real interesting data on meditation in the medical field and how it can help people with stress and chronic pain and other health issues.
Absolutely.
And then the other thing I did today that I didn't think of before is the fact that with our new genetic technology, and this relates directly to Fertility Answers, is that we have all our patients get screened for genetic diseases, because about 1% of couples are walking around with matching silent mutations that could put them at very high risk for having a child with severe disease like cystic fibrosis or muscular dystrophy, and really have no idea, no family history, no ethnic risks, nothing. And before they get pregnant, we can test them. We usually in the clinic use blood, but they also have saliva available. So for one of my couples today that's brand new, we just ordered the test online, and the company just is going to mail them a kit. They'll get it in the mail. It'll be a little paper kit, and there'll be a little tube, and they just literally spit into this little test tube, and then they'll mail it off. There'll be a mailing label. They'll mail it off, and a lot of people are getting coverage by insurance. Some people are not, but this company is making it accessible to a lot of people, and in 4 weeks they'll get the results. It'll dump into their portal, patient portal, and then the genetic consults are done on the phone anyway. So that's our normal method of business, is to do the genetic consult on the phone. So here they're going to get this very powerful piece of information, and it is totally virtual. So
that is a new way of doing the thing that they would have done in the clinic anyway,
right?
Just through saliva, so they can stay at home and be safe. And what I'm hearing from you, though, Serena, which is so encouraging, is that you actually found that these consults were a little bit more connected and focused on kind of like your human to human connection as a medical provider with your patient, which is lovely. I mean, that's a beautiful benefit. If you come out of this situation with having telehealth consults on a routine basis, then I imagine, we're going to see a pretty positive impact on patient care.
I think you're right, Alice. Like, I think, we started doing this telehealth as, in some ways, as a compromise. Right. But I think it might move forward to being like the new normal, the new better normal, because, like meeting the doctor without having to go into the clinic, maybe that's the way it should be. Maybe we should be like, let's get to know each other first and make sure that it's kind of a good fit before, you do all this other stuff. And it makes, I think also the first appointment when you come into the clinic, this is really cool because my coordinator makes the appointment. So that's, I guess, is the very initial contact. But, the patient doesn't have to, sometimes the patient comes in and they're like, oh my God, I had so much trouble parking, and the valet line was really backed up. And, like it was really, and there was traffic, and, right. And now, like, I get to connect with the patient, and all that baggage is not there. And we can start our relationship, maybe in a less stressful way. That might be kind of nice.
I think so. I think that you'll end up having more consults than IVF cycles, because there are so many people who need the consult with the specialist.
Oh, absolutely. Absolutely.
And timing of treatment can come later, or maybe in some cases they don't even need treatment, but they do need more
just advice. Exactly. Just advice might be enough.
Right, exactly.
Yeah.
So the one thing that I do see that, kind of coast to coast, it's still a challenge, is the coding. We do know that federally specialty consults in a telemedicine environment are supposed to be reimbursed at the same rate as an in-person consult. But that's
the rumor. I think none of us know that for sure yet, but they have given us new codes, and they are saying that's what they're going to do. And because it's just as much work, it's just as much work.
It is. It's just as much work. It's just that in the fertility field, we have, because of lack of infertility coverage itself, I feel like we haven't had a good systematic approach to the coding and getting coverage. I've heard from some doctors say, gosh, I only get $20 back if I do if I do a telemedicine consult. So they don't even bother billing, because it's actually cheaper to give it away for free than to have their overhead cost of even putting the paperwork through.
I think that's going to change, though. I think that's going to change.
It is going to change. I 100% agree. I think we're in the best possible place for it to change.
Yeah.
You know, MedAnswers part in that is that we have telemedicine portal being built, HIPAA compliant.
I can't wait. I can't wait. When are we going to get this thing? And are you and I going to try it soon?
Yeah, we'll try it soon. 2 weeks.
Okay,
so
cool.
beta might even be ready in 10 days, and you'll be one of the first beta testers.
Okay.
But we're so excited. And then the next step beyond that is going to be the automatic insurance verification on your behalf, so that you don't have to use humans to do that. It'll all just be automatic. I think that, you know, the time has come. We sped development because of the state of the world. We know that the direction we have to go.
Right.
But I love hearing from you that, you know, what patients can expect is like better connection, more focused.
Yeah.
You're not being pulled and nobody's knocking.
I know. You're not like, hey, there's a patient in the other room and you have to finish up. Yeah, it's kind of nice. And you know, like, I don't know, in New Jersey, parking's always an issue. So
same thing with LA.
Yeah.
LA is always an issue too.
So yeah,
I agree with you. Like, to remove that giant stressor of like leaving work, getting there on time, the parking, doing all the things, paying for the parking. Oh, I don't have the cash on me, and this isn't an automatic. This isn't a meter that takes a card. I mean, there's a million variables. More stress just to walk into the office.
That's true. That's very true.
And so I love that you're adapting this so fast. I love that you've pivoted so gracefully and that you're enjoying the experience. And I love especially hearing that you're being so proactive in all the things that patients can do in the meantime while staying at home. Figure out what their treatment plan is going to be.
Yeah. Yeah.
So,
no, there's so much to do. And like for our follow-up patients, we do a lot of online teaching. So, and you know, the online teaching takes a long time. Like, we use a video program and they do all their consents online. And, you know, when I do the in-person visits, I have to tell you, like, they cover the in-person visit, they're rushing to the office. And then I'm like, so did you watch the videos? And they're like, oh, we forgot. Yes. Yeah. And now I'm like, you have no excuse now. Okay.
Yeah, that's right. You don't have
no
any
excuse.
Exactly.
Yeah.
I know. I remember doing the same thing when I was going through treatment, having to watch all the courses and everything and the injection training and all of it. So look, this is Monday Motivation, is that there's so much you can do by phone, connecting with your provider. Serena's available via her website, or she's available to book with her directly through the MedAnswers platform. We have about 300 experts available to everyone through Fertility Answers on iOS and Android. Hang in there, everybody. This is the new normal, but it's a good normal.
Yes.
We'll see you on the phone, and we'll see you next week.